Hi, thank you for watching this video. Do you suffer from sciatica? Do you or a family member or a loved one experience sciatica and are not sure what to do? Do you experience pain from your lower back down to your knee, or maybe further down to your foot and in the bottom of your feet? Do you experience this numbness? Do you have pain at work while sitting, and every time you get up you feel this excruciating pain zapping down the back of your leg? Do you live with constant numbness? If you can answer yes to all these questions, you have reached the right place. My name is Pierre Buteau. I'm a physical therapist. I've been helping people with sciatica for the last 17 years. I have worked with patients from all backgrounds with various condition and various type of sciatica, from your typical sciatica and bulging disc to symptoms like piriformis syndrome, which is a common diagnosis that doctor send us patient for. Are you not sure what to do at this point? Were you recommended to have surgery? Maybe either right away or as a last resort, and you would like to avoid that. Or maybe you've had surgery, you've had some rehab, and you think that your progress are still stalling. Maybe you were recommended to get an epidural injection. Maybe cortisone steroids were recommended, and maybe you are on your third injection and you would really like to go a different route because clearly you shouldn't have needed 3 injections and your improvement have been really temporary. Are you all puzzled and have a lot of questions about, well, what is my next step? I would like to really get rid of this problem and continue living the rest of my life normally, being able to sit without experiencing sharp pain. I would like to be able to resume my activities, my sports, being able to run and all that stuff. Well, I have some answers for you. At Buteau Physio, we do things a little bit differently, as I do treat a lot of patients that have had very recurrent symptoms, that have worked with other therapists without much results. I offer concierge style treatment. I treat my patient at their house in the privacy of their own home. I bring all the equipment needed. I spend one-on-one time with my patient. This is only me, and I spend a good 60 minutes to 90 minutes with each patient, where we have time to discuss your concern, go over your goals. I have time to explain what is going on, what is creating this sciatica, what you need to do, what you should be avoiding, what movement you should be avoiding or position you should be avoiding. I go into great details as to assessing all the tissue, the muscle, the bone, your flexibility, your strength, the mobility of the nerve, your sciatic nerve in particular, and the other nerve that emerge from that, the mobility of your spine, to figure out where really the root cause of your problem. What is the root cause of that sciatica? No matter if you've had some imaging done, you've had an MRI or a CAT scan that showed that you do have a bulging disc, or you have some stenosis or arthritis that is creating what we call radiculopathy, so that's sciatica. No matter if your scans are showing this, there is still something that you can do conservatively, and at least or can try before even thinking about getting surgery. Of course, there are some emergencies. So if you do feel symptoms like loss of bowel and bladder, that's an emergency, and obviously physical therapy won't be enough, and you should be a neurosurgeon immediately. For most, and I would say maybe 95% of all cases of sciatica, there is always something that can be that you can be helped with with the right physical therapist. Like I said, I've been helping people for quite some years, and today I have some offer. So you are probably reaching me on this page because you've seen the free report. So in this free report, I go over 11 tips, different things, what to do to address this sciatica, some common tips, some less known tips. There are some links to videos of particular exercise to be performing in order to address your sciatica. But remember that everybody is different. Everybody has different needs, has a different body, and even some of those exercises may need to be modified in a certain way with different position. So this is my first offer, is that ebook. So start with this. Go over it, try all this stuff. Feel free to reach out to me for questions. You can either by email or by text or by phone. For the people that are already ready to move on with this sciatica and really want someone to find out the root cause and start the right kind of treatment, I do offer a phone consultation. This phone consultation lasts about 20 to 30 minutes. It is completely free of charge. During this time, we schedule a time where we can both have the time to discuss your condition, your sciatica, the particular type of sciatica, where I start a subjective exam where you can tell me your history and your symptoms with this episode of pain of sciatica. And from there, I can help already start making a diagnosis and give you some tips on what you can change as well and what should be your next step. No matter if you've already seen a medical doctor, another physical therapist, a chiropractor, or surgeon, every medical profession has something to offer in the treatment of sciatica, and physical therapists, I believe, are the most well placed to do that, as we can rule in and rule out more serious and acute or as well as emergencies, which if would be the case, I would refer you directly to a medical doctor. But generally for most of other type, this is something that you can greatly be helped by learning the right thing, the right positioning, the right posture, what to avoid, what to change in your car, as driving tends to be a major exacerbation in your sciatica symptoms. So this phone consult is available. You can go on my website. You will find the link on this page to schedule a free consultation on the phone. Now, for people that are not sure if really physical therapy is the right thing, maybe they have had physical therapy. They've seen many physical therapists and have been not receiving the right care, or have not seen really change in their symptoms, or not as much as they were expecting. Maybe they've been disappointed by what they've been told. Maybe they've gone to a doctor and they've been told, this is something I cannot help you with. You're gonna have to live with it. Maybe you've already had a surgery to address this sciatica, but somehow some of the symptoms are still there, which should make you wonder if whatever was repaired in the surgery was really the right source of your problem. I've also had some patients that have come to me with thinking that it was their hamstring that was creating the pain, and truly that was a sciatica. The sciatic nerve runs along the hamstrings and can create some symptoms that are sometimes fairly similar. So that's another thing to consider, and that's something I can help you get on the right track with. No matter if you choose to work with me, I can still help you see the right person for you if you don't end up working with me. So for people that are skeptical, again, I do offer a free discovery visit. It is at no charge, and this is a visit that would last 30 minutes, where we would have likely talked on the phone before and gathered some information, and I would be able to show you what our treatments are about and what we can do, which is a blend of exercise and positioning, posture, neuromuscular re-education. Is in the case of sciatica, of course, neural mobilization, which is key. If you've had therapy and for sciatica without neural mobilization and the right kind, you basically wasted your time. So during this discovery visit, I would go over all this with you, and I would be able to show you how to mobilize that sciatic nerve as well. So don't hesitate. There is a link on this page as well to schedule a discovery visit. If, of course, you are ready to book, feel free to call us, leave us a message, send us an email, text us. We will get back to you as soon as possible, and we will get you in as soon as possible. We generally are able to fit you in within the first 48 to 72 hours after we talk on the phone. So please don't live with sciatica, and don't expect these symptoms to go away, as it generally takes some education and a full-on PT approach to resolve. The meds themselves, if you're taking meds, that's not going to be enough. Again, something as the injection, they generally address the symptoms, not the cause of the problem. And I do believe that physical therapists in this day and age are the back specialist to go to first in order to solve your back problems. So don't hesitate to call us, text us 425-281-4171. Email us, pierre@butophysio.com. There will be a link on this page as well for this. Please, we are here to help. Know that we've helped hundreds of people with sciatica get better, and you are not alone in this. There is an end to this tunnel here that you are probably stuck in with this sciatica. So don't hesitate. Again, my name is Pierre. I am a physical therapist, and I would be glad to help you. So don't hesitate, and reach back to us, and you have an awesome day, hopefully without too much sciatica symptoms. So, all right, bye-bye.